Yeah, I think, I mean, something that was also interesting was in the field of RCC, and then we do struggle with later lines of therapy, and we don't have much evidence, So what we offer in third, fourth line of therapy is whatever is available, and that is also a proper reflection what is written in the guidelines. Because we don't have solid evidence. And so I think that changed with ESMO 23, and Laurence Albiges, she presented on Belzutifan in the use of later lines of kidney cancer treatment. And basically, I mean, we have seen it outperforms everolimus. And I think something that was surprising is that you do have about 20% of responses, which is far more than with everolimus. But when you look for the median PFS, it's not different. But overall, the hazard ratio is improved by 25%. So you reduce the risk for progression by 25% when you use Belzutifan. And it's really surprising because, you have a late split of the curves, and it almost looks like an immunotherapy curve, to be honest, because you have this long-term responders, you have, you just have, it seems to stabilize quite nicely at the later or the second part of the PFS curve. So I think it is coming to the market probably, so it will be filed, and I think it will add up our armamentarium, and we have to find out where it's being used best, because there has been some activity-seeking studies for novel combinations, Belzutifan, cabozantinib. Did they do well? They did. It was feasible to combine, and outcomes were really interesting. Let's put it that way. So PFS of 30 months in first line is really interesting, but I think the body of evidence is small. I think it really supports to move forward with that drug and use it in combinations as well. So I think it's quite exciting, and we will have to see how those current ongoing phase 3 studies do report in a couple of years' time.